Good morning and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. I'm Fitz. I'm here with a good friend of Shatkin F.I.R.S.T. His name is Dr. David Hippensteel, and he's from Dickson, Tennessee. He has a mini dental implant center of America down in Dickson, which is a little west of Nashville.
Just west of Nashville, exactly. Yep.
Right.
Yep,
And
yep.
we've been down in Nashville for the Academy meeting. It's a great place to, I'm
Awesome.
sure you love practicing down there. And
Yeah.
Originally from Philadelphia, though.
Really, Philadelphia. Go Eagles. Yeah.
Go Eagles,
Go
man.
Eagles, yeah.
Go Eagles. So we're excited. But we're discussing it. Dave's here at our two-day course, our February course. But we're discussing a little bit about the restorations that he's doing at his MD-ICA practice. So he told me that he's doing a lot of fixed on 6 cases.
Fixed on 6, fixed on 8, you know.
Yeah,
Yep.
great on 8, fixed
Great
on
8,
6.
Yep.
Tell us what's so great about this restoration? Like why is it more beneficial than dentures?
Yeah, and I think it's great. I mean, first of all, the reality of it is patients come in without any teeth. And it's just pretty miraculous that they can come in, we can put these mini implants in there, and then have them walking out with a smile like this. And just it's an amazing service that we provide. But
that's a resin bridge?
This is actually a resin bridge. This is actually a temporary that goes in between the time that you actually place the implants and then place the final.
So in this situation, you have this resin bridge, right?
Yep.
So this shows the O-ring housing in the restoration. I hope you can pick that up, Dave. But
that's correct.
In this case, we placed 12 implants.
Yes.
So how many implants do you put in the jaw?
So it all depends on the bone. Like obviously this is a perfect scenario where you've got everything is ideal from area of tooth number 2 all the way to 15. You don't always get that in the mouth, but you put in as many implants as you can. And the cool thing about mini implants is you can get the most implants in no matter what the situation you're given. So if you can get 7 in, if you get 6 in, you can get 10, 9, doesn't matter. Those implants, you put them in where the most bone is, and you put it centrally located in the particular area that you're placing it. And then you've got a situation where you can put in, rather than doing something like this is where I was talking about, like this is great for a patient comes in, they're used to having dentures, and you get a situation where you can put just say 6 implants in, and then you've got something similar to a denture where you've got the flange here on the outside, but you're able to cut out the palate, and so
it's retained with
the implants,
6 or 8 mini implants, what have you.
Yeah, compared to a denture, loose denture flapping, this is awesome. But if you want to take your patient to the next level, you have situations like this. Where
that's the cemented roundhouse.
Yeah, so this is a cemented roundhouse where you're placing more implants, as many as you can, providing the bone, whatever the bone allows, and then you're able to cement something like this where you have no flanges. It's the most like your natural teeth that you possibly can get.
So basically what you're talking about is, so we got a lot of acrylic on this denture, right?
Exactly.
And your
not
patient
be as
might
strong,
say, can I get rid of this? And here we see a little bit of the pink gingiva, right?
Yep, exactly.
But we
Depending
also
on their
do
smile
this,
line.
right?
That's correct,
So
yeah.
if you didn't want any pink, why would you put pink porcelain above
It
those teeth?
depends on the smile line. So when they smile, if they're showing that area, you want to have something that simulates their gum tissue.
Gotcha.
So that's exactly how that works.
Understood.
Great question. Yep.
Yeah.
Yep.
So
that's you have that situation right here, like this one.
Yeah.
Exactly right. So.
Okay.
Yep.
That's great.
And you can go up even higher if you need to, depending again on the smile line.
Okay.
So
okay.
yeah.
Wonderful.
But yeah.
So in the roundhouse cases, how long does it usually take you from start to finish? And I know you said you did put the temporary.
Yeah. I mean.
So when the patient comes in, you place the implants.
Right.
You take and then you make that resin. You put a resin bridge on for the healing.
That's the cool thing, because so if the patient is already a dentulous, so they come in, they've already got dentures, and they said that we want the best, we want to go to a roundhouse. What you're going to do is you're going to take out the dentures, you're going to put in the implants, and you can actually have a pre-made temporary bridge. This is actually a temporary resin bridge here.
Right.
You can have one pre-made at the lab.
It's very light.
To simulate where those implants are going to be, and then based on estimating where they're going to be, you can actually pick the denture up with the housings in it from the implants, and they can actually walk out with a temporary resin bridge. It's an amazing thing. That's the shortest ideal situation.
Yeah.
Other situations where you actually have to do the extractions of the teeth, and then give it 4 months. Sometimes you can put a few in, at the time.
Right.
And then you can still do something like this. You're just going to have less implants and less housings to grab onto, but understanding it's a temporary situation till the rest of the bone heals, and then you're able to place the remaining number of implants and then place the final bridge. Gotcha. So you could do that, if it takes 4 months, usually we like to give it 4 months to heal. And so within 4 months, we take a final impression, we finish putting the implants in, take a final impression, and then we're able to get the final bridge.
Gotcha.
Within, let's say, a month. So 5 months.
Yeah, 5 months.
Yeah, and they're walking out with perfect teeth.
For your final, from start to finish, we're talking 4 or 5 months.
Exactly.
Right.
Yeah.
That's great.
And the bottom line is you're changing people's lives, because people come in and they're just their mouths are a train wreck, and it's not their fault. I mean, it's like we live in a world where there's a lot of adversity against our teeth, from our diet, from everything from our diet and accidents, that kind of thing. Yeah. And to be able to have that patient come in, they're just like, they can't smile. Their social life is just like, gone pretty much. They're embarrassed to be around even their family. They can't eat, so nutritionally they're going downhill physically. And we're able to just kind of change all that. It's an amazing service that we can provide.
And I bet that brings a lot of satisfaction.
It does. It is. It's the most. I've been doing dentistry for 35 plus years. And it's the most fulfilling thing in dentistry that I've ever done. I wish I would have discovered it earlier.
I've
been doing it probably, going on close to 5 years, 4 or 5 years now. Yeah. And anyway, so.
Well, that's excellent.
It's been good.
Dr. Hippensteel thank you so much. That was excellent information. Yeah. And if you need to know more about how to do roundhouse cases or fixed on 6, whatever your preference is, please call Shatkin First at 1-888-4-SHATKIN. You can ask for Kevin, Nick, or Fitz. And check out our website as well for our upcoming course dates. We'd love to see you out at a course. And until we see you next time, have a great time placing mini dental implants and monodental implants. And we look forward to seeing you on the next Monday Morning Minute. Thanks a lot, Dr. Dave.
All right. Yeah, thanks, man.
Appreciate it.
Yeah, absolutely. Yeah.
I also, before we leave this Monday Morning Minute, I want to tell you about the Chicago Midwinter Dental Show. Come visit us out at our booth. We're going to be lecturing at our booth. We always love to see our dentists in the Midwest, and Chicago is such a great city to have a dental show in. So come out and see us. And then in March, we're going to have an advanced course. The March course is already filling up because the advanced course is so awesome. Dr. Shatkin's going to be doing live surgery, and those dates are March 9th and March 10th. It's a Thursday and a Friday course. We also wanted to announce to everybody that our International Academy of Mini Dental Implant Symposium is going to be held in Las Vegas, Nevada at Caesar's Palace on June 22nd and 23rd. As always, if you have any questions whatsoever, you need anything from our lab, please don't hesitate to give us a call. And we look forward to seeing you next week on the Monday Morning Minute.